Quadruple A stroke, also known as a cerebrovascular accident, CVA, is an acute medical emergency that occurs when the blood supply to the brain is disrupted. It can occur due to many reasons, but the two most common types of stroke are ischemic stroke and hemorrhagic stroke. Ischemic stroke. This type of stroke is the most common, accounting for about 85% of all strokes. Ischemia by definition means reduced blood flow to a part of the body. It occurs when a blood clot or plaque buildup blocks or narrows an artery, reducing blood flow to a part of the brain. As a result, the brain cells are deprived of oxygen and other nutrients, which in turn leads to the death of brain tissues within minutes. The blockage can form either within the brain's blood vessels called thrombotic stroke or travel from another part of the body and get lodged in a brain artery called embolic stroke. Causes of ischemic stroke include atherosclerosis. Atherosclerosis is the thickening or hardening of the arteries caused by a buildup of plaque in the inner lining of an artery. Plaque is made up of deposits of fatty substances, cholesterol, cellular waste products, calcium, and fibrin. As it builds up in the arteries, the artery walls become thickened and stiff. Cardiovascular diseases. Conditions such as heart disease, atrial fibrillation, and irregular heart rhythm, or heart valve disorders can increase the risk of blood clot formation and subsequent stroke. Blood clots. Clots can form in the blood vessels due to conditions like deep vein thrombosis, DVT, or certain blood disorders. Other factors: smoking, high blood pressure, high cholesterol, diabetes, obesity, and a sedentary lifestyle can contribute to the development of ischemic stroke. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain ruptures, causing bleeding into or around the brain. The leaked blood puts pressure on brain tissue and damages it. Hemorrhagic stroke is more dangerous than ischemic stroke, as in most cases, the affected person will suddenly lose consciousness, and the symptoms will get worse very quickly. Generally, the prognosis in hemorrhagic stroke is poor unless early and effective treatment is instituted. Causes of hemorrhagic stroke include high blood pressure, hypertension. This is the most common cause of hemorrhagic stroke, as prolonged high blood pressure weakens and damages the blood vessel walls. Aneurysms. Weak spots in blood vessels can bulge and form aneurysms, which may rupture and cause bleeding. Trauma or injury. Severe head injury or trauma can damage blood vessels and result in bleeding in the brain. Regardless of the type, a stroke can lead to brain damage due to the lack of oxygen and nutrients reaching brain cells. The specific symptoms and effects of a stroke depend on the area of the brain affected. There are 11 warning signs and symptoms, which may predict an impending stroke. 1. Sudden numbness or weakness. One side of the body may become weak or numb, such as the face, arm, or leg. 2. For example, a person may suddenly find it difficult to lift one arm or smile properly. 3. Slurred or garbled speech. Difficulty speaking or slurred speech is a common symptom of a stroke. 4. The person may struggle to articulate words clearly or may be unable to find the right words to express themselves. 5. Severe headache. A sudden, severe headache that is often described as the worst headache of one's life can be a warning sign of a stroke. 6. Vision problems. There may be sudden vision changes or loss of vision in one or both eyes. 7. Blurred or blackened vision, or seeing double, are examples of such symptoms. 8. Dizziness or loss of balance. The person may feel lightheaded, experience vertigo, or have difficulty maintaining balance, leading to unsteady walking or stumbling. 9. Confusion or trouble understanding. A stroke can cause confusion, disorientation, difficulty in comprehending conversations or instructions, and difficulty making decisions. 10. Difficulty in swallowing. If a person suddenly has trouble swallowing or feels food or liquids are getting stuck, it may be a sign of a stroke. 8. Sudden, severe fatigue. Extreme tiredness or fatigue that occurs suddenly, without any apparent cause, may indicate an impending stroke. 9. Nausea or vomiting. Some individuals experience nausea or vomiting along with other stroke symptoms. 10. Facial drooping. One side of the face may droop or feel numb, making it challenging to smile unevenly. 11. Loss of bladder or bowel control. In some cases, a stroke can lead to a loss of control over bladder or bowel function. This can manifest as urinary or bowel incontinence. So simply keeping these 11 symptoms in mind, one can easily spot or at least suspect someone with an acute attack of stroke. And remember, timely helping them seek immediate medical attention may save someone's life. Timely treatment can significantly improve the chances of recovery and minimize the long-lasting disabilities which may ensue if the treatment is delayed due to any reason. Furthermore, for educating the general public on identifying and responding quickly to the symptoms of stroke, the National Stroke Association, American Heart Association, and others use the acronym FAST. F stands for face drooping. One side of the face may droop during the stroke. Ask the individual to smile to check if their smile is uneven or not. A stands for arm weakness. One arm may become weak. Ask the person to lift both arms to see if one arm drifts downwards. S stands for speech difficulty. Ask the person to repeat a simple sentence, and if the words are jumbled or unintelligent, it may indicate a stroke. Now, in the last part of this presentation, I must say that this video on stroke will remain incomplete if I do not mention what is called transient cerebral ischemic attack. This is the most important warning sign that is telling the affected individual and everyone in the family to immediately take them to the concerned healthcare professional for evaluation and appropriate treatment. Or get ready for a far more severe impending stroke attack, which may prove fatal. A transient cerebral ischemic attack, often referred to as a mini-stroke, is a temporary episode that mimics the symptoms of a stroke but typically lasts for a shorter duration. It occurs when blood flow is temporarily disrupted to a part of the brain. Unlike a stroke, which causes long-lasting brain damage, the transient cerebral ischemic attack, on the other hand, typically resolves within a few minutes to hours. The symptoms may last for a shorter duration, often less than an hour, but usually resolves completely without leaving any permanent neurological deficits. However, I repeat, it is essential to remember that the symptoms of a transient cerebral ischemic attack should never be ignored, as they indicate an increased risk of a future attack. And in the end, I will ask you to subscribe to my channel, motivating me to come up with more informative videos on mental health. Thank you.